In this lecture, we will discuss Gardner's syndrome, a genetic disorder that causes multiple colorectal polyps and other health issues. We'll talk about the causes, symptoms, and treatment options, so you'll have a good grasp of this condition. In Gardner's syndrome, mutations in the APC gene can impair the function of the APC protein, which regulates cell adhesion and the WNT signaling pathway. These mutations can increase the risk of developing colorectal polyps and cancer. Colorectal cancer in Gardner's syndrome is caused by APC gene mutations, disrupting the WNT pathway. This leads to abnormal beta-catenin accumulation in the nucleus, promoting cell proliferation and survival. Colonic polyps form and can become invasive cancer if untreated. Distinguishing Gardner's syndrome from other FAP variants, such as attenuated FAP or Lynch syndrome, can be challenging due to overlapping clinical features. However, certain characteristic manifestations can help differentiate Gardner's syndrome. In addition to colonic polyps, individuals with Gardner's syndrome often present with epidermal cysts, desmoid tumors, jaw osteomas, and retinal pigment epithelial hypertrophy. Genetic testing is crucial in confirming the diagnosis, where identification of APC gene mutations specific to Gardner's syndrome can provide valuable insights into the disease pathogenesis and guide appropriate management strategies. The management of colonic polyps in Gardner's syndrome involves regular endoscopic surveillance and polyp removal. Patients undergo colonoscopy every 1 to 3 years, starting in their teenage years. Polyps are removed using techniques like snare polypectomy. Adjuvant chemoprevention with NSAIDs may reduce polyp burden and cancer risk. While the APC gene mutations primarily drive colorectal tumor genesis in Gardner's syndrome, they also contribute to the development of various non-colonic manifestations. Skin tumors, including epidermal cysts and fibromas, are commonly observed in affected individuals, likely due to the dysregulation of WNT signaling in the skin epithelium. Other non-colonic manifestations, such as osteomas and desmoid tumors, result from unique molecular mechanisms involving a combination of genetic and environmental factors. Elucidating these mechanisms is essential for developing targeted therapeutic approaches. Skeletal abnormalities, including osteomas, dental abnormalities, and jaw osteomas, are frequently encountered in Gardner's syndrome. Osteomas, typically found on the skull and long bones, are benign bone tumors resulting from aberrant WNT signaling. The management of osteomas involves a combination of surgical excision, when symptoms or cosmetic concerns arise, and regular monitoring due to the potential for growth and functional impairment. Dental abnormalities, such as supernumerary teeth and odontomas, may require dental interventions, including extractions and orthodontic treatment, to maintain oral health and prevent complications. In this section, we will discuss cutaneous desmoid tumors, which often develop in people with Gardner's syndrome. Diagnosis is difficult, requiring imaging tests like MRI or CT scans. Treatment options include surgery, radiotherapy, and medication, depending on individual factors. Collaboration between different medical specialties is essential. Dentofacial manifestations, including supernumerary teeth, odontomas, and jaw osteomas, are common features in Gardner's syndrome. Presence of these abnormalities can aid in the diagnosis of the syndrome, especially in patients without a significant burden of colonic polyps. Early identification and management of dental problems are necessary to prevent complications such as crowding, malocclusion, and cyst formation. Regular dental checkups, panoramic radiographs, and interdisciplinary collaboration between gastroenterologists and dentists help ensure optimal oral health and overall patient care. Apart from the gastrointestinal manifestations, Gardner's syndrome entails an increased risk of developing various extracolonic tumors. Individuals with Gardner's syndrome require close surveillance to detect and manage these tumors promptly. Recommended surveillance protocols include regular imaging examinations, laboratory tests, and clinical assessments specific to the various extracolonic tumors associated with this syndrome. Adrenal tumors, thyroid carcinoma, and soft tissue tumors, among others, necessitate tailored screening and therapeutic approaches based on patients' individual risks. Endoscopic surveillance and polypectomy play pivotal roles in the management of colonic polyps in Gardner's syndrome. Advanced endoscopic techniques, such as endoscopic mucosal resection, EMR, and endoscopic submucosal dissection, ESD, offer improved efficacy and safety in the removal of larger or more challenging polyps. These techniques enable en-bloc resection, thereby reducing the risk of complications and the need for extensive surgical interventions. Considering the technical complexity of these procedures, appropriate training and expertise are essential to ensure optimal patient outcomes. Genetic testing plays a vital role in identifying APC gene mutations in individuals at risk of Gardner's syndrome. Various testing modalities, such as Sanger sequencing, multiplex ligation-dependent probe amplification, MLPA, and next-generation sequencing, offer different levels of sensitivity and specificity in detecting mutations. Positive genetic testing results have significant implications for both the affected individuals and their families, warranting comprehensive genetic counseling to aid in understanding the disease inheritance pattern, the potential for transmitting the disorder to offspring, and the importance of regular surveillance. Given the diverse range of clinical manifestations associated with Gardner's syndrome, a multidisciplinary approach involving gastroenterologists, geneticists, surgeons, dermatologists, and other specialists is crucial for optimal patient management. This collaborative approach ensures coordinated care, timely diagnosis and treatment, and comprehensive surveillance of both colonic and extracolonic manifestations. The multidisciplinary team should engage in regular case discussions, share expertise, and tailor treatment strategies to individual patient needs, with the ultimate goal of improving patient outcomes and quality of life. In conclusion, Gardner's syndrome is a complex condition with diverse and severe complications. Understanding its genetic basis, association with colorectal cancer, and varied clinical features is vital for accurate diagnosis and optimal care. A multidisciplinary approach helps improve patient outcomes. Thank you for watching.